So hihani washte, iuha chante washte nape chuziapi, wanakshawi machiapi. Good morning, everyone. I greet you with a warm heart and a handshake. My name is Lillian Sparks Robinson. My Lakota name is Flower Woman, and I'm a member of the Rosebud Sioux tribe, and I'm also Oglala Lakota. And it is my honor to return back to the Department of Health and Human Services as your MC for this very important event and to join all of you over the next 2 days. I want to thank all of you for being here and bearing with us as we get started. We appreciate all of the protocol that you did to get in the building with your ID and going through the metal detectors. But as you know, this is a federal space, and so we appreciate your patience as we make sure everyone gets in. We hope you find the content presented over the next 2 days to be informative and inspiring and information that you could take back home with you to use in your communities. We want to thank our partners at the Department of Health and Human Services, at the Veterans Administration, the White House Council on Native American Affairs, and all of our tribal organizational partners for helping us to put on today's event. Before we get started, there are a few housekeeping items, and then we'll start with our protocol. If you're looking for the restrooms, you can find them outside of this great hall. You'll just need to turn left, and they'll be past the elevators, and you'll see them on the left-hand side. So again, if you're looking for the restrooms, they're just out this exit past the elevators on the left. If you'd like to use the internet, you can select the HHS guest and hit accept, and you'll be connected at that time. So again, that's the HHS guest. We also have timekeepers here in the front for those of you who will be participating on this stage today. And so I think they're making their way to the front, and they will gently remind you of how much time you have left, because as you can see from our agenda, it's pretty tight and we have a lot of really great information and presentations. We want to make sure everybody has an opportunity to present during their time allotted. And at this time, I'd like to introduce Mr. Chris Tallbear, Southern Cheyenne, and Lance Fisher, Northern Cheyenne Nation, to perform our opening song and prayer.
Well, Pivawonat, good morning. It's good to see all of you guys here bright and early this morning. I know that, like she said, we have a big agenda and we have a lot of things to go through. My name's Chris Tallbear, and I am a Southern Cheyenne. My Indian name's Magpie. Usually when we go by those, when we pray in Cheyenne, we go by our Cheyenne names. And I'm from the South. My brother here is Lance Fisher. I'd like him to introduce himself.
Pivawanat, Pivatawan Matsis, Lance Fisher, Naveho Ibebe, Mahio Nanako, Nahish Sisive, Nat Sista, Nihoe Mohmotavas, Na Nakoe Hotnihotse, Ove Manhan Ehistahayot, Nakotsio Miamhayot, Epivatamano Na Piwamota, Hanahane. Good morning. My name is Lance Fisher. I'm from the Northern Cheyenne Tribe. Thank you.
Yay. All right. I'm going to go to the Creator in prayer. Ask you guys pray along in your own way. And you timekeepers, get ready. No, I'm teasing you. No. You haven't heard a Cheyenne pray yet? No, I'm teasing. So let's go to the Creator in prayer. The Creator, we thank you for this day. We thank you for giving us this time together. We come to you with humility and humbleness. We pray that you bless each and every one of us here in this room, door in and door out. We pray that you bless our homes, our children, our grandchildren. We pray that you make a road for those that haven't made it here yet. We pray for our veterans and our service people. The things that are going on in our country, Creator. I pray that you be with, our leadership, our current leadership, and the details that they've got to take on. And I pray that you be with our incoming leadership too, Creator, that they can, judge what's good and do things that are right for the good of our people, Creator, and that they listen to their hearts and do the right thing, Mahel. I pray that you be with each and every one of us here, those that are suffering, those that are lost, those that are trying to find their way. I pray that, these traditions and these ceremonies can help find who they are, Mahel, and those that are in the nursing homes, those that are on the streets, those that are suffering from substance abuse and mental illness. I pray that, they find strength and can find their way, to being good, productive human beings, Mahel. And I just pray that, if we've overlooked anything, that you forgive us and, help us, keep going, Mahel. And okay. Lance is going to honor us with a Cheyenne flag song and a veteran song.
Okay, the first song I'm going to sing is a flag song composed by Morris Medicine. It talks about a young man who travels over the seas to protect and defend our way of life and earn the status of being called a warrior. The second song I'm going to sing is a veteran song composed by Perry Little Coyote. It also talks about a young warrior, or young man traveling across seas, and the composer feeling good, seeing him return, and also attaining the status of being called a warrior. Yo, hey, hey, yo, yo, hey, yo, hey, yo, yo, hey, yo, hey. Hey, yo, yo, hey, yo, hey, hey, yo, hey, yo, hey, hey, yo, hey, yo, hey, hey, yo, hey, yo, hey. No talk, hey, hey, esta, te yone wo, te sta kovese, hey, hon, hey, wata te, eso, hey, vese, momoto, hey, hey, tan, hey, vesta, te, neho, ta, mesta, no, oh, hey, oh, hey, hey, oh, hey. Yo, hey, yo, hey, yo, yo, hey, yo, hey, yo, hey, yo, hey, yo, hey. Yo, hey, yo, hey, yo, yo, hey, yo, hey, yo, hey, yo, hey, hey, yo, hey, yo, hey, yo, yo, hey, yo, hey, yo, hey, yo, hey, yo, no take yo, se taco, hey, yo, no what I say, yo, hey, hey, tane vestote, ne hota mestano, hey, hey, na pavetano, se heva hawa mata, say, yo, hey, yo, hey, yo, hey, yo, yo, hey, yo, hey, yo, hey, yo, hey, yo, dan ho se heva ho ma da hey Nia ish ho. Thank you.
Thank you both to Chris Tallbear and Lance Fisher for starting off our traditional healing summit, Culture is Medicine, in such a good way. We appreciate your words and your song and blessing us this morning with that prayer. At this time, it's my honor to introduce our first speaker to provide some remarks. It's my pleasure to introduce the Deputy Secretary of the Department of Health and Human Services, Andrea Palm. Andrea and I worked together under the former previous Obama administration where we traveled to Indian country, and I can tell you firsthand the dedication and the commitment she has to serving Indian country and all of our communities with regards to public health in all arenas. So I'm so pleased to be able to see her once again and introduce her to all of you. Deputy Secretary Palm serves as the Chief Operating Officer for HHS, overseeing the day-to-day operations of the programs and services that impact American health. She is a strong ally of Indian country, having spent time in tribal communities across the nation, including the Oglala Sioux Tribe in South Dakota, Alaska Native villages, and the Puyallup Tribe of Washington State. These trips have been personally inspiring to the Deputy Secretary and to her dedication to Indian health. The Deputy Secretary has also led the department's initiative to create a first-of-its-kind tribal data access policy to facilitate more efficient and accessible data protocols across the HHS's agencies. Please help me in welcoming DepSec Andrea Palm.
Good to see all of you. Some familiar faces. I am Andrea Palm. I do have the privilege of serving as the Deputy Secretary here at the U.S. Department of Health and Human Services, and I want to welcome you all to HHS. I know and see many tribal leaders. We have traditional practitioners here, advocates, among academics, others that I recognize here in the room. So please welcome to the Humphrey Building and to this really important event. I also want to acknowledge and thank the White House Council on Native American Affairs for their partnership in planning this summit. I'm sure you've all noticed, and many of you have seen before, the tribal flags hanging here in the Great Hall. I just want to note the significance to this administration in hanging these flags, and for those of us who come into this building every day, what an important reminder they are for the obligation and the partnership that we have with Indian country and the work that we need to do together to improve the health and well-being of all Americans, including, again, our partners and communities all across Indian country. That visibility really does matter to us, and it really is an important reminder to us every day of the work that we do. Health disparities carry a really big cost for communities across this nation, and it's hard to concentrate on work when you're sick. It's hard as a kid if it's not safe to play in your neighborhood, or if there aren't actually infrastructure and places to play. It's not helpful in building the strength not only of the body of children but of their minds. It's difficult to eat well when the bodega around the corner has chips and Hostess cupcakes, but you've got to go miles and miles and miles to get fresh produce. And those are all issues that I know are more concentrated in some communities across this country, including in tribal communities. And as you all are very aware, Native Americans and Alaska Natives are significantly at greater risk and experience worse health disparities than other parts of our country and of the general population, including higher rates of obesity, diabetes, cancer, mental illness, substance use disorders, and suicide. And for the past 4 years, this administration, this president, and this vice president have worked really tirelessly to make healthcare more accessible, more equitable, and to help improve health outcomes for American Indian and Alaska Native communities. We've reduced barriers, limiting access to quality, affordable health care, and helped create opportunities so that folks can get the support they need to lead healthy lives. We increased access to health and human services related programs, and more broadly, we have begun to shift this country from being focused on a system of illness to one that supports wellness. The administration, as Lillian noted, thank you for your introduction. As Lillian noted, we are working very hard to bring across the finish line a first of its kind tribal data access policy to advance transparency, accountability, and respect for tribal sovereignty when it comes to the data that we here at HHS have access to and possess on your behalf. And we have continued to invest in new infrastructure, expanding mental health and substance use disorder treatment and support. We've worked to address social determinants of health and created pathways for health workforce development, recognizing the really significant workforce challenges in Indian country. In partnerships with tribes, the Indian Health Service has conducted more than 250,000 telebehavioral health visits for child, adult, and addiction psychiatry and counseling, which translates to over $1 million in avoided travel costs and over 25,000 hours of work and school that were not missed. And we've worked hard to reduce administrative burden and improve access for tribes to unmet federal funding needs. The most recent example, after what I know has been a very long effort by many in this room, is in this past October, we announced the approval of Section 1115 demonstration amendments to allow Medicaid and CHIP coverage of traditional healthcare practices provided by the Indian Health Service, as well as by tribal facilities and urban Indian organizations. Traditional practices, as you all know, such as music therapy, sweat lodges, traditional dance practices really help with physical and mental health and have been a way of life long before we ever got here. And so it was really important to us that as deeply rooted as they are in the cultures and the health of your communities, that we recognize them as part of how you think about holistic health care for your communities and recognize the science that tells us they are as effective in your communities as Western medicine. So these amendments, we really feel strongly, will help to expand access to culturally appropriate health care and improve the quality and the outcomes for tribal communities across this country, and particularly in the states where these amendments have been adopted, which are Arizona, California, New Mexico, and Oregon. So the discussions about traditional medicine that you will all have over the next couple of days will further our collective work in this space to help tribal communities improve the health and well-being of your communities where you live and work. We really do at HHS look forward to continuing to move the ball forward on these efforts and are anxious to hear the outcomes of your conversations and the work that we can continue to do together. So again, welcome to the Humphrey Building. Have a great event, and thank you so much for your time this morning.
Thank you once again to our Deputy Secretary, Andrea Palm. It was great hearing about all of those updates and knowing that we have a strong advocate here in the department to allow for these flexibilities, as we all know how important it is for us to be able to practice our traditional ways and the healing powers that they have. At this time, I'd like to introduce the Deputy Assistant to the President for Racial Justice and Equity at the White House Domestic Policy Council, Kylie N. Patterson. Kylie Patterson is an accomplished programs director, consultant, writer, researcher, and public policy leader with expertise in economic, small business, and workforce development. Her commitment to economic equity and drive led to previous appointments as Chief Opportunity and Inclusion Officer at CHIPS for America and Director of Diversity and Inclusion at the U.S. House of Representatives Financial Services Committee, where she researched and drafted legislation to support Black, Indigenous, and people of color, women, veterans, those with disabilities, and those in underserved and rural areas. Please help me welcome Kylie Patterson from the White House Domestic Policy Council.
Thank you so much, Lillian and Deputy Secretary Palm, for your opening remarks and for your incredible leadership of HHS. I want to say thank you all so much for your time. I don't take this for granted. And thank you so much for waking up early, especially for those coming and joining us from the West Coast. Good morning, everyone. So my name is Kylie Patterson, and I'm so fortunate to be here with you today, partly because I almost can feel my father here. So my father passed in 2011, and he, when he first graduated from medical school, he joined the Indian Health Service. And he served in Arizona. Someone asked earlier, they said, do you know exactly where he served? And unfortunately, sometimes after someone passes, you realize all the questions you wish you would have asked. But what I do know is that my father, from my early age, he was always very committed to teaching us not only about his medical knowledge, but the knowledge he had learned while he was on with those communities. And in fact, we think about the work we've done with indigenous knowledge, and I still think back to how my father would always give two prescriptions, one being the traditional prescription and the other being one around the holistic health of his patients. And so I just want to say thank you, and truly, if Walter Patterson was here, he would say thank you as well. So I'd like to offer special acknowledgement to the tribal leaders in attendance and the traditional healing practitioners. Your leadership, guidance, and expertise are not only welcome at this traditional healing summit, but they are essential and they are respected. And that has been a hallmark of the Biden-Harris administration, respect for tribal nations and for nation-to-nation relationship. President Biden has fostered over the past 4 years an administration that prioritizes the dignity of tribes and Native communities. And that has played out through policies and legislation that has sought to transform how the federal government does business with tribes and how the government listens to tribes and Native communities. One of the most transformative acts the president has taken has been the record number of appointees of Native American heritage. Over 80 Native appointees over this administration. This is huge, because what we know is we can't beat what we can't see. This includes, for the first time ever, a Native American as the U.S. Treasurer of the United States, the first time a Native American as head of the National Park Service and the head of the Army Corps of Engineers, and, of course, the first Native American Cabinet Secretary was Secretary of the Interior, Deb Haaland. President Biden committed to having a cabinet and administration that looked like America, and that includes Native America. And why does this diversity and inclusion matter? Well, among other things, the virtues, it creates better policy for the country. Secretary Haaland and the other Native American leadership in the administration have helped to create center Native voices in federal policymaking. You've already heard earlier about the CMS reimbursement for traditional healing, but the fact that CMS will now cover traditional healthcare practices at Indian Health Services and tribal communities across Arizona, California, New Mexico, and Oregon is a long time coming and is also a sign of progress. The recognition and respect for traditional healing practices resonates strongly with other related efforts, such as the White House's memo to agencies on indigenous knowledge. For the first time ever, the White House issued guidance in 2022 to federal departments and agencies on the importance of indigenous knowledge, or IK, and how IK should be respected and incorporated in federal policymaking. A foundational part of this policy is that IK should be used with the consent of the tribes and Native communities from which the knowledge comes from. Again, that value of respect runs through all the Biden-Harris administration policies that support Indian country. Now, I want to take a moment to acknowledge something that's happened recently. The President has acknowledged that to move forward in a spirit of truth and healing, the darkest parts of our nation must be acknowledged and accounted for, which is why the President made the historic move last month to apologize for the federal Indian boarding school era. The federal Indian boarding school era lasted over 150 years, during which the federal government forcibly took Native children from their homes, their tribes, and their communities to boarding schools often far away. The children endured trauma and abuse of all kinds, physical, sexual, and emotional. Many children lost their lives, nearly 1,000. And the boarding school era forever changed the landscape of Native peoples in this country. Survivors and descendants of survivors have long urged that the President issue an apology on behalf of the United States, but it wasn't until President Biden that a president made this move. The apology is a first but important step to healing, and healing is the essence of this summit this week. In closing, I'd like to offer gratitude to the healers here today and those participating. The Biden-Harris administration has focused on dignity for tribes, Native communities, and culture as a cornerstone of its policy framework. We've made positive, enduring change, but that's only come through the leadership and advocacy from tribal leaders and Native advocates. You know, one of the things that my father would always include in his recipe, if you will, or his prescription, was he would always remind his patients to keep their hope. He said, without hope, all things are already lost, so you must maintain your hope. I used to, as a child, think, oh, Dad, like, what is that? You know, they want more Dayquil. But what I realized is that it really is medicine to us all. And so I, for one, am committed to continuing to work with all of you as we fight for continued progress moving into the future and to maintaining hope and belief that we can heal our communities and, of course, continue to heal ourselves. Thank you all for being here today, and I wish you all a productive summit.
Thank you so much, Kylie, for sharing your words from the Domestic Policy Council, but also sharing some of your personal story. I think that's also part of healing, right, is making that connection and building those relationships. I also want to acknowledge Morgan Rodman, who's accompanying Kylie. He is the Executive Director for the White House Council on Native American Affairs. He's a member of the Cherokee Nation and Osage, and has been just an incredible leader for all of us during this administration. So thank you, Morgan, for that. Next, I'd like to introduce Admiral Rachel Levine, the Assistant Secretary for Health and head of the United States Public Health Service Commission Corps here at the Department of Health and Human Services. Admiral Rachel Levine fights every day to improve the health and well-being of all Americans. After graduating from Harvard College and Tulane University School of Medicine, Admiral Levine completed her training in pediatrics and adolescent medicine at the Mount Sinai Medical Center in New York City. As a physician, she focused on the intersection between mental and physical health, treating children, adolescents, and young adults. Admiral Levine was a professor of pediatrics and psychiatry at the Penn State College of Medicine. Her previous posts included Vice Chair for Clinical Affairs at the Department of Pediatrics and Chief of the Division of Adolescent Medicine and Eating Disorders at the Penn State Hershey Medical Center. I am so very honored to introduce Admiral Rachel Levine.
Well, good morning. And on behalf of the Office of the Assistant Secretary for Health and the Public Health Service Commission Corps and our dedicated officers, I echo the Deputy Secretary's welcome to all of you to our great hall, the Hall of Tribal Nations. And I am very pleased to join my friend and colleague, Director So, the Director of the Indian Health Service, for this summit. We tremendously appreciate the time and the travel, and the extensive travel, that you have each undertaken to join us. And I want to acknowledge the traditional healers and cultural knowledge carriers who are here and who also are observing online. Thank you for your leadership, thank you for your partnership, and caring for the health of your communities. Everyone in this room works for the common good and works to make all of our communities and our nation whole. And you all do that with empathy, with compassion, and understanding. This Traditional Healing Summit is emblematic of the Department's commitment to our government-to-government relationship. Secretary Becerra, Deputy Secretary Palm, and the leadership of the administration recognize the federal government's special relationship with tribes and how that relationship extends into all areas of healing, including support for traditional healing. Now, in my role as the Assistant Secretary for Health, I work every day to make our nation healthier. And that includes a nation where the health equity that we fight for today will be normalized tomorrow, and I still believe that. To build that more equitable future, I focus on my mission to make our nation a better, healthier place. And our vision at the Office for the Assistant Secretary for Health is healthy people, healthy communities, and a healthy nation for all. Healthy People 2030, which is in my portfolio, defines health equity as the attainment of the highest levels of health for all people. And I firmly believe that we have not made progress unless we have all made progress. And we take this responsibility very seriously. Now, in my role, I've had the chance to travel around the nation to hear firsthand what people are experiencing on a range of public health issues. And this includes tribal communities in Alaska, in Arizona, in the Dakotas, in Oklahoma, in Kansas, and the Pacific Northwest, to speak with tribal leaders, traditional healers, and community members. I heard from tribes in rural Alaska who are on the front lines of the impacts of climate change, and they are watching while the permafrost melts under their feet and their houses slide into the ocean. Their native food sources migrate to colder climates. They face decisions about buying expensive canned goods that are flown in, or to use that money to buy hunting supplies in the hope of finding sometimes increasingly scarce game. Access to nutritious food is critical to health, and food is an essential component of a person's ability to thrive. But we have much to do in regards to this. Earlier this year, I had the opportunity to visit the Navajo Nation. Classified as a food desert, there are only 13 grocery stores that offer fresh fruit, vegetables, and basic supplies. So I saw that many families, many seniors had to travel over an hour each way or more on dirt roads to get a meal from the senior center. Some drive to other states to obtain food, and they face many issues of environmental injustice there, including 523 abandoned uranium mines impacting their water, land, and carrying contaminated particles in the very air that they breathe. So we can only accomplish this ambitious goal of food and nutrition security and reducing diet-related diseases if we work together. And I'm really pleased to see that there's a session dedicated to food is medicine, because food is medicine. In all aspects, it's medicine. So in closing, despite the heavy toll that the last 4 years have challenged us with, they have reminded us of a fundamental truth, that we truly need each other, that our happiness and our very survival depend upon our connections to one another and our community, and that it is that spirit of community that truly makes our country great, and it's what we need now more than ever. All Americans deserve care and services that are timely, affordable, accessible, equitable, and high quality, and that includes traditional healing, which is essential to public health. And there's much to be done to uplift, integrate, and support traditional healing practices in tribal communities and beyond. So I and our team look forward to engaging with you all and learning over the next 2 days in the follow-up actions of this summit. Thank you all so much for being here. Thank you.
Thank you, Admiral Levine, and for reminding us that the work doesn't stop tomorrow, right? It doesn't stop here in Washington, D.C. It's really about what are the next steps? What are the actions we're going to take after we share, learn, and think about how we can improve upon health equity? Because as Admiral Levine mentioned, what we fight for today, we're hoping will be normalized tomorrow. And it can take time, and it's a process. And we're going to hear now from those who participated in our 2019 Health Summit, and hopefully we'll be able to see and measure some of the progress we've made since then. It is my honor to introduce Dr. Dave Wilson, who's going to provide us insight on the 2019 Traditional Medicine Summit hosted by the National Institutes of Health. Dr. Dave Wilson, who serves as the inaugural Associate Vice President for Health Research and Chair of the world's first Department of Indigenous Health at the University of North Dakota. Prior to his current role, he served as Senior Policy Advisor with the White House Council on Native American Affairs and previously served as the inaugural Director of the National Institutes of Health's Tribal Health Research Office. Please join me in welcoming Dr. Wilson.
Good morning, everybody. It's a pleasure to be here. It's so nice to be back in DC. It's been quite some time since I've had to wear the green armband. You see lots of friends in the audience, so it's wonderful to see you all here today. We are here at a wonderful gathering today, and I wanted to capture some of the highlights. Admiral Levine talked about life on the reservation, and that's so important because, as we all know, historically, many of our communities were relocated to rural communities or rural areas that were deemed almost unlivable. And as a result of that, there's a lot of health issues that have continued to follow our communities. So in 2019, on November 20th, so very close to this time, we held the very first Traditional Medicine Summit that was sponsored by the National Institutes of Health. It was in collaboration with the CDC and also as a part of the NIH, the National Center for Complementary and Integrative Health. Now, this was such a groundbreaking event because at the NIH, nobody really had an understanding of what traditional medicine really was. And this goes to the point of having Native people serve in these high-level positions, how critically important this is. I am a member of the Navajo Nation. My clans are the Bitterwater Clan and the One Who Wanders Around. And I've been serving as the NIH Tribal Health Research Office Director, the inaugural director, and since 2017. And it was at that time when I first began my role as director, our NIH Tribal Advisory Committee came to me and said, Dave, we need to do something about this. There's not enough recognition about our traditional ways of healing, and that needs to be incorporated into what we do and how we serve our people. It also can expand the array of health interventions and healthcare mechanisms and services that we provide to our community members. So with that, and also our TAC was very knowledgeable on understanding that policy is data-driven. We live in a very data-driven world. And so it was really important to understand how can science and research support traditional healing. And so we began this conversation. We had wonderful collaborators like Dr. Joe Gone, Dr. Don Warren, Dr. Spiro Manson. Many other high-level academics came together and talked about their experiences of how to approach this conversation in a very respectful way. And we did so. We had a 2.5-day gathering. We had over 40 traditional healers come to the Anschutz Medical Center in Colorado. And we had this wonderful conversation about what role science can play in supporting traditional healing. And those conversations were so fruitful that it began the conversations with CMS and others. But I also must say that this has not been something that has been started overnight. This didn't start in 2019. You know, people like Dr. Carroll and Dr. Kitty Marks at CMS, they have been pursuing this for many decades. And so they've been really struggling on how to do this. And so all of the academic world came together along with our healers and the world's leading biomedical research institute to help support all of the evidence that we were able to provide to make sure that this moved forward in a meaningful way. So I was really happy to see how all of this would come together and how this has led to this event today, how these 1115 demonstration waivers are going to proceed, because they are opening a door. They're opening a door for us to allow our community members to rely more on our culture, which many of us know more than the Western side of healing. And to have that incorporation, I think, will also increase the retention of our individuals who are receiving healthcare in medical facilities. We'll add that cultural layer or that cultural awareness, but it will also provide additional array of opportunities for us to think about the preventative part of healthcare, which I think is so important. Right now, we're all focused on the reactive part of healthcare. When somebody develops a condition, that's when we want them to go seek treatment. But we want somebody to be, as we, in the Navajo way, is to walk in beauty. We want to find that balance every single day where we're not ill or we're not, we're in that right happy space, and that's exactly where we want to be. So again, I wanted to thank you for allowing me to come and share some insight today on the Healing Summit. I would like to invite Mr. Chris Tallbear to come and share some of the thoughts of his active participation in the event, and from his perspective. So thank you so much.
Me again. No, I enjoyed this 2019 Traditional Healing Summit. I was a little bit nervous and took off. I should have asked my wife to check my suitcase, make sure I had everything, but when I showed up, I didn't have any socks. And I'm in front of everybody. So I did wear socks today. I did remember those. My wife is here to keep me in line. Some of the themes that came out of this, I was humbled. I was very humbled to be a part of this event and new to it. I'm kind of new to this realm where traditional and governmental intersect, and I do feel like, we need to inform our leaders, our feds about what's going on in our communities, but we also need to inform our traditional people about things that are coming. This traditional medicine, being reimbursement, cost reimbursement for those services. Our Cheyenne people, our communities, we have a lot of these strengths. We have a lot of these ways. We're fortunate that we did not lose them, and they're still being carried on. But some of the themes that come out of this that are translatable, we talked about perceptions of these traditional healing practices. That translates to the spirituality aspect. The translation of traditional healing into Western medicine, and what we don't know is the humility aspect of it. We go into these, with no expectations and, open-minded. The protection aspect of our traditional healing and our traditional ceremonies goes with the sustainability aspect of it and how these things are going to be carried on, how we're going to pass on these ways, and also our contributions to the overall group, to the discussions and everything, and our own perceptions, and that is the accountability aspect of being able to, provide that unbiased feedback to what's going on. But I thought that the 2019 Healing Summit was, it prepared at least me for what was coming. COVID changed our lives, and it just completely changed things. So, having that connection with other spiritual leaders, other traditional leaders, helped get through a really, really difficult time, and also to help, what was coming. So I just wanted to wrap that little bit up. I know that we've got some other speakers. Real quick, before I get off the stage, November 29th, 1864, Sand Creek Massacre, had relatives there and had survivors there. Coming up November 27th, 1868, we had Ouachita Massacre. And 1878, 1879, the winter, we had Fort Robinson breakout, where Cheyenne people broke out of Fort Robinson, and, we literally ran for our lives. So those events we commemorate every year, and those, what our people went through, and the survival. I don't know what wintertime campaigns have to do, but it was a really tough time, and we're coming up on that. We're getting ready. This country talks about Thanksgiving and being thankful for the things that they have. We're thankful to be alive and still be here. So, hina hane, aho. Thank you.
Thank you so much, Chris, for, again, your prayer this morning, but also sharing reflections right now. I do want to give a little background on Chris so you understand all the work that he's done in the public health realm for over the last 20 years. He currently serves as the Tribal Public Health Advisor for the National Network of Public Health Institutes. And as you can tell from his words, he has a deep understanding and appreciation for his Cheyenne culture and traditions. Although he has earned degrees in the academic world, he considers his true education is through his lived experience and participation with his own tribal community, and I really appreciate you taking the time to share all of that with us this morning. At this time, we're going to go into our panel, which is the first panel of these 2 days, Traditional Healing Policy in Action. I'd like to introduce the moderator, Dr. Carmela Roybal, who will introduce our two distinguished guests, Loretta Christensen and Robert Otto Valdez. Dr. Roybal currently serves as a senior advisor in the Office of the Director at the Agency for Health Care Research and Quality here at HHS. So please help me welcome our panel to the stage.
Good morning. Sengi Tamu. Navi Hawa Tampo Vianamu. My name is Carmela Roybal, and I'm really happy to be here. Welcome, everybody. Welcome to DC. Thank you for all of those who traveled. I'm excited to introduce our panel, who will be discussing the future of what traditional healing and medicine looks like as we move forward in the integration into our health systems and into practice. It's one thing to have all of our knowledges, but in order for us to move forward with our health and improve health outcomes, chronic illness, and all of these different pieces that we're addressing, we really need to understand and embrace all of our traditional knowledges. So with us we have here today Dr. Loretta Christensen, is an enrolled member of the Navajo Nation and serves as Chief Medical Officer of the Indian Health Service. As a general surgeon, Dr. Christensen brings extensive experience in both Western and traditional modes of care. Specializing in medical acupuncture, functional medicine, Dr. Christensen integrates traditional ways of healing into practice. We also have Dr. Robert Burciera Valdez, who is the director of the Agency for Healthcare Research and Quality. Recently elected into the National Academy of Medicine, Dr. Valdez's commitment to improving access to quality health care and reducing disparities among our tribal community is unwavering. This year, Dr. Valdez launched ARC's Tribal Healthcare Research and Quality Improvement Initiative, which will take us into the future, transforming care for Native communities nationally. Let's welcome our guests. Thank you. So to begin our discussion today, we have a few questions here, and we'll start off with thinking about, by definition, traditional health systems of care are patient-centered. They're rooted, they're community-focused, they're rooted in tradition, and how can these systems of care teach our health system here in the U.S. and improve our health system? What are some of them? And I'll pass it to you. Thank you.
Yes. Good morning. Nice to be here with all of you. For me, I've been a doctor for over 40 years, and the paradigm of medicine has always been that we have to take care of the patient. We were taught you need to tell them, you need to guide them, you need to tell them where they need to be. What I think this change in traditional healing now being for all is it gives us a chance to pivot to a health system that's different. Instead of telling you how you have to heal and everything, I need to listen to you. And so I think what happened with medicine over time, it basically assimilated the entire country into being that way. We have the chance to show the difference with this opportunity because we are self-healing, we are spiritual, we do look at all aspects of care as being part of us. And with that, we take this across to medicine and say, no more. We want to be part of everything that happens. We want to be part of the decision. We want to understand what's being said. We want to guide the way we heal. And I think we can do it. With all the work we did in COVID, where the strength and resilience was just amazing and exceptional, we have the power and strength as Indigenous people to say this is the way medicine should be. We should address all aspects of every single patient. I just will say really quickly, I used to get in trouble on rounds because I was supposed to keep up with everyone, and I was talking to the patients. And that served me very well, though, as through my career, that was much more important to me, to connect to the patient and answer their questions, ask them if they needed anything, and ask them what was important to them. And I think together we could really take this very far in making the medical system in this country today so much better for our experiences. Thanks.
Thanks very much. Chris, I want to let you know, I also have socks on. My wife didn't let me go out without them. I had the privilege of teaching first and second year medical students at the University of New Mexico Medical School prior to taking this position at ARC. The Agency for Healthcare Research and Quality's mission is to improve health care for all in the country. And so that's what we're trying to do. But that experience teaching in the medical school made it very clear that our biomedical processes are really quite limited and focused on physiological processes, organ systems. And yet the patients who would come in, many from Pueblo communities, from Navajo, from Apache, would come in and quite honestly, their traditional healing traditions were not taken into account. There wasn't that clinical recognition that those healing traditions are great resources for the patients. So for clinicians who actually want to provide effective care, they needed to really understand the great resources that exist in the communities and among the healers in those communities to work in tandem with those communities and with those healers in order actually to provide the most effective care possible. And it's this discussion that we're having today and tomorrow that'll allow us to basically help teach some of those clinicians about these ways and about what's important. One of the things that I think has been important here at the Department of Health and Human Services for the last 4 years is that we've had a department-wide effort to finally bring together the mind and the body. We haven't got to the spirit yet, but we have been trying to integrate the mental behavioral health care with the physiological health care that is so focused in our care delivery systems. In fact, most states have a separate system department from the physical health and the mental health. And oftentimes they have public health, which deals with the environment. And all of us know that the environment, the food, the water, the land are important aspects of keeping people healthy, not just whether or not people are going to be able to recover from when they're ill. And it's this effort to try to bring these pieces together that the biomedical community is finally, and clinical community, is finally beginning to recognize again in a new movement called whole person health that the VA is helping lead. But they can only do that with increased understanding of what traditions exist in our communities. And with the conflicts that go on in urban centers in particular, where there are culture clashes, there's often confusion both by the patients and by the clinicians about what to do. So I'm hoping that today and tomorrow's discussions will allow us to bring together some strategies and ideas for how to help how that culture clash occurs. Because 20 to 40% of all Americans use some kind of non-biomedical healing system in their daily lives. They may not recognize it, but if you ask anybody, do you do yoga? The other day I asked that question, about 3/4 of the hands went up. Do you do meditation? About 3/4 of the hands going up. Well, meditation for most of us is prayer, and it just hasn't been recognized.
Thank you. What steps in your minds should be taken to integrate these knowledges into our systems? So the actual integration, what would that look like in practice?
Well, great question, and I think there's some of my sisters out in the audience. We had the opportunity to do a meeting with the American College of Graduate Medical Education. We had a roundtable that we invited tribal organizations and federal sites to talk about how do we make doctors better in the future. And we came away from that conversation saying, of all the 6 principles they teach residents, which are wonderful, there's a 7th one that is called cultural appreciation and integration. To go into a community, not to tell them how things are, but to learn how they think things are and they need. And it was very, very well received that this education has to change. Now, for those that are already doctors, that's my job, that's his job. We look and try to say, okay, well, let's take you back. Let's give you some integration into the community, because I think our doctors are most successful when they join the community in which they work. They will stay. We have doctors in IHS 20, 30, 40 years because they became that community. They became part of that community. And that is the most successful way to work together with all of us in tribal communities. So that is one of the ways is we got to just change that mindset. We have to open it up. We have to integrate it with understanding whatever culture you're serving. You have to honor it. You have to respect it. So I think it starts from there. And then for those of us who've been out and practiced a really long time, we could still learn. We can still see what happens to be in harmony, to be in balance with the patients. And I will tell you, the future of medicine, they're not all going to come into a clinic or a hospital. So we are going out to the communities now. We are increasing that workforce that goes into the communities to check on people, to care for them, to do screening, to do prevention. And that gives us an even better opportunity to send our staff and our teams out there to really learn how people live, because they just hear about it. But if you're actually there and you're actually experiencing it with a family with no electricity, with no running water, with roads that you can't get by in certain types of weather, then you start thinking, well, that's why that patient can't come in. I'm going to have to find a different way to get to them, not just put them on a list, did not show. So we have to change that whole perception of the way we practice medicine in rural and extreme rural areas by integrating everybody into the communities that they serve. So it starts with that learning and that willingness to become a member of the work that you do with the people that you serve. So I am encouraged. I think we can do it. I think we can lead the way, and others will look at what we did in indigenous communities, and they will grow strength to also do the same to the cultures and ethnicities and races that they serve.
I can't agree more, Dr. C. Becoming part of the community, understanding the community is central to being a good healer. Unfortunately, in the conversations that we have with training physicians, we've not talked about healing. That's the funny part. You go to medical school, you never hear that you're going to be a healer. It's only those of us who come from the outside that we begin to talk about healing and healing systems that people begin to wonder, what is it that we're really doing? We could easily be a plumber or mechanic. We're just fixing things that have gone wrong in the system, rather than recognizing the whole person, the whole community. Because healing is not just about the individual patient, but it's also about the patient's family. It's about the patient's community. And sometimes the practices that we engage in not only affect whether or not a particular patient recovers, but if you can also provide resources and recovery for the family and for the community, then the whole system becomes whole again. And it's that process that I think that we're trying to affect both in these conversations and in the work that we're trying to do in other communities. My experience is in the urban centers primarily, where we've tried to look both in the United States and in Mexico, in Oaxaca in particular, co-locating traditional healers with biomedical clinicians. The co-location still has a mentality, though, of you come to us, you come here. We're setting the place, we're setting the time when you can seek care for an illness or an affliction, rather than what you just suggested, which is we really need to get out. And a lot of the work that we have done in Oaxaca and also in the urban centers is a real recognition that you can't just wait for people to come. If we're interested in also wellness, we have to, in fact, not just wait for an affliction to be identified or occur, but to actually take the initiative to actually become part of the community, to understand the family, and to understand the needs of that complete community.
When we think about, thank you for that. When we think about traditional healing, we think about healing. That means that something needs to be healed or corrected or something. How do we move the discussion to integrating intergenerational knowledges, traditional knowledges into prevention?
Well, again, I think it's really the connection with the patient to learn where they came from and what made them who they are. You're not just a person that shows up and has a headache or something. There's all these things that go into who you are. There's the historical trauma. Maybe it's a historical trauma of your parents or grandparents, and that's passed down intergenerationally. It stays in the family. And so we can't erase it, and we shouldn't, but we should find ways for you to be better with what had happened, and how do you deal with it? And how is this affecting your health? And I will tell you that the body is self-healing, so if you are stressed, if you are depressed, if you are anxious, this affects your health. Probably, I'm not going to find anything. It's looking at your spirit and your soul and the way you see it, and how do I help you? How do I help you get what you need to be back in balance, to be back in harmony, or hosho, as we say in Navajo. We look for that every day, as Dr. Wilson said, and that is actually more important. I mean, I'm a surgeon by trade, so sometimes you operate because you have to fix something structural. But I tell you, people will heal or do better after surgery if they're fully included in what you are doing. You explain it, you give them options, you let them decide. I even let them decide what day of the week they want to be operated, because one day feels better to them. It is so important to take and honor that you will get a healthier person that will recover, and they'll do very well. But if you just do another case or do another visit, you will miss that opportunity to truly connect with what that patient needs. So I think you do bring all of, our past is all part of us. It's part of our DNA, it's part of our mind, it's our memory, it's what we see in our families, but we can heal, and when we heal, I think as Robert said, you also heal the family, and we also heal communities. What do we do when we need help now? I say go to the elders, go to the community, have them speak to people, have them talk to our young people, help with substance use disorders, help with all this issue, because they know, they've been through it, they're wise, they can share with their communities. And so I think we have a fantastic opportunity to take advantage of this pivotal change in medicine for traditional healing to be integrated, and with this opportunity, it can be more. We can expand more and more. The next step of that is for us to integrate that all with the medicine that we provide on the quote-unquote Western side. So.
Well, most healing traditions are really not about illness. It's about maintaining a balance, maintaining that sense of wholeness, that sweet spot that was talked about earlier this morning. That's in the middle of being euphoric all the time to being ill or having some type of affliction. And every community defines what that affliction is or how they identify affliction. In biomedical sciences, the affliction is usually some dysfunction of an organ or an organ system. The chronic illnesses that we have are the result of chronic infections or exposure to toxins in our community or in the food that we eat. And that everything gets explained in that direction. Whereas real healing systems, and if you think about healing, is really about how you find that balance. As Dr. C said, she's a surgeon, so sometimes some of the treatment means excising things from the body. In other cases, treatment means ingesting things or having, whether it's a pharmaceutical or having an injection of a vaccine in order to allow the body to gain its balance and its defenses against whatever it is that's causing the affliction. But I think increasingly, if we think about and reintroduce the notion of being healers to our biomedical community, I think we'll go a long way in actually beginning to make some headway in this conflict between the way people think about biomedical medicine, which is physiological, processes oriented, and the recognition that as we get more and more understanding of the biology, the epigenetics of our body actually are taking a recording of all those things that we've been exposed to, all those things that we're able to understand, fight, but also historical. I mean, part of the historical trauma is built into and recorded in our epigenetics. And it's that science that really relates to the biological processes that allow the biomedical people to say, oh, yeah, you had stress or you had trauma. That's actually physiologically causing this other thing. And it's that final recognition that we're only now beginning to have that allows us to begin, I think, to reintroduce, at least to the biomedical community, the notion of being healers and to take a look at the whole person, their families, and their communities.
Thank you. So we have, I think, where's our timekeepers? I just want to make sure that I'm okay. I want to introduce this idea that when we think of Western medicine and we think of traditional medicine, can anybody in the room tell us how long our medicine as Indigenous people has been around? 10,000 years? 12,000? So we have recorded over 30,000 years in this continent where we're standing right now. 30,000 years. So our medicine has been here since the inception of man walking on this earth. And you'll hear throughout the rest of these next 2 days all of the different ways in which our communities are returning to the medicine that was forcefully eradicated through what was the boarding schools, through all the mass, agendas that forcefully removed and eradicated many of our populations. With those agendas, it removed a lot of our medicine, our knowledges about land, plant, water, balance, and all of those different pieces. And so when we're thinking about Western medicine, you could probably look on a calendar and note that it's far younger than Indigenous knowledges or Indigenous medicine. In fact, it's in its infant stages. Much of what's is starting to be revealed through science, Indigenous people have been living and have known for thousands of years, passed on time immemorial. So I'd like to thank our panelists today. So Kundawaha, thank you very much. Thank you, everyone, and we hope that you enjoy the rest of the summit. Thank you.
Thank you so much to Dr. Royable, Dr. Christensen, Dr. Valdez for an incredibly interesting and enlightening conversation. Absolutely, doctors are healers, and if we help them shift their mindset, it helps bring back some of the humanity to the science. We need the science, we need the data, we need to understand, structurally how the body works, how our minds work, but we also need to help our doctors who spend so much time having to do diagnosis and preventative care to help them understand. We respect them as healers and embrace that role, so thank you for that. I love that our past is all of us. It is, and it's not just through our the epigenetics and the DNA, but it's in how we carry ourselves. We just heard Dr. Royable talk about 30,000 years we've had this medicine, 30,000 years we've had this knowledge, and we're talking about it now in 2024 about it being recognized through White House orders of Indigenous knowledge, through these new flexibilities that are being provided through these demonstration programs. And our next panel is going to be talking about this as well. But we're going to take, I just understood, a 15-minute break because we want to make sure all of our panelists are available. quick reminder, so the bathrooms are through this door to the left, past the elevators. If you need water, we have coffee over here with all of the accoutrements. Please help yourself. If you need more than coffee, you can go up to the penthouse, which is PH on the elevator, and quickly grab water or tea if you need something else. But we're asking folks to come back here in 15 minutes. So thank you.
Produced by the U.S. Department of Health and Human Services.